Asking a well-structured research question is a fundamental step in research methodology. For this, we follow the PICO analysis. PICO, each one should form a component of your research question. The P would stand for the patient, problem, or the population you want to study or research on. I would stand for the treatment or the intervention you want to do. C would stand for the comparison you want to compare your treatment with. Sometimes you can skip it, but it mostly sticks around. And last but not least is your O, which is the outcome. The outcome has to be very specific for any research question. So to summate, these are the four components of any research question. For example, if we want to find out which is the best treatment for decay, you can see that there is no patient or population defined. You could say decay is a problem, but it's not being specific. Does not ask for which is a perfect intervention. There is no comparison group, or there is no outcome either. So the proper way to ask this question would be, in patients with decay, is it better to treat with a similar amalgam filling or a composite filling? Some researchers like to add the fifth component to a research question, that's the time. Let's look at another sample question. Is paracetamol more effective than brufen to reduce toothache for more than 6 hours? So here you can see that almost all the components of the research question are there, but there is a catch. You look at the word effective. Effective may have different meaning in medical research. It is commonly confused with efficiency, and so you should be very clear when to use what kind of word when you're asking the research question. So efficacy is the total theoretical peak performance of any drug. For example, if you're going to test a drug in the lab, you would find that it kills almost all the organisms. But however, that is not true in real life. Either the doctor forgets to give the right prescription or the patient forgets to take the medication. There are so many factors that can confound the effects of the drug. And this summative performance of the drug in a clinical scenario is the efficiency. So when you ask a research question, you should be very clear as to whether you're looking for an efficacy-based trial or an efficiency-based trial, and that would completely change the way you're going to do your research. Another area where researchers have to be very careful while framing the research question is the use of the word survival versus success. For example, if you're evaluating the success or a survival of an implant, the implant is said to be surviving if it is just in bone and is not infected. It need not be functional. However, to call the implant successful, you need to have the patient using the implant and it should be functionally loaded. If not, it is only considered as survival. So similarly, these kinds of words have to be given very specific attention while designing the research question. So that concludes a short session on the methods of designing a research question.